So, Dr. Arvind, this scenario is
Yes, sir.
not a mistake scenario.
Yes,
Okay.
sir.
And the second thing
Yes, sir.
is, in the discussion, it is hidden in the scenario. Whenever we
Yes,
used
sir.
to start any medicine, we used to inform the patient the side effects and
Yes, sir.
the possible complication if it is associated with any medicine, and it
Yes,
is
sir.
verbal consent is taken for this patient. Okay, it is hidden.
Yes, sir.
So you
Yes,
you
sir.
have to inform to the relative of the patient that the steroid is started after the verbal consent, after informing her the risk and benefits. Okay,
Yes, sir.
it is not one of the rarest complication. It is like uncommon complication of
Yes,
steroid.
sir.
So we
Yes, sir.
have to choose the proper word also
Yes, sir.
according to the side effects. If the
Yes, sir.
medicine is having side effects, we have to inform the side effects of medicine, any medicine. If you are going to start, if the medicine
Yes,
is
sir.
having any medicine having more than 10% chances, we have to
Yes, sir.
highlight those side effects. Okay.
Yes, sir.
In this condition, this patient developed psychosis. It is not very common, but it is not very uncommon also. So it is like
Yes, sir.
less common side effect. So it is side effect.
Yes,
It is not complication.
yes, sir.
This,
It's a
this
side
should
effect.
be
Let's
this
complete.
should be here. This should be
Yes,
informed
sir.
to the patient relative that it is like this.
Yes,
Okay.
yes, sir.
Unfortunately, she developed these side effects, and it is less common. It is not very common. And this medicine is
Yes, sir.
started after informing her this side effects of the medicine, and she agreed. Okay, but I feel sorry for it, but it is not a mistake.
Yes, sir.
You may quote this
I feel
if
sorry for
she's
the
yeah if she's saying like this is your mistake. You can say I appreciate your concern. I'm sorry to say you that you are
Yes,
in
sir.
distress and your mother developed these side effects, but uh, actually
Yes,
it
sir.
is started in the best interest of the patient, but it is not a mistake. It
Yes,
is
sir.
not started by the mistake. It is
Yes, sir.
started in the best interest of the patient. Okay. And the second thing,
Yes, sir.
here we have to stop the steroid immediately. Okay.
Yes, sir.
Any time
Yes,
whenever we are giving the steroid less than 10 days time, we can stop the steroid
yes, sir.
immediately. No need to taper. Okay.
Oh, yes, sir.
So
Yes, sir.
in this scenario, the hidden uh, agenda is also included. That is, you have to you have to reassure the relative of the patient that steroid is already stopped. Okay,
Yes, sir.
steroid is already stopped, and it is
Yes, sir.
temporary condition. Whatever your mother developed, it is temporary condition, and it will
Yes,
improve within hours to days, not in a
yes,
month.
sir.
Okay,
Yes, sir. Yes, sir.
this is for reassurance of the patient. We cannot give exact timing, but what we have
Yes,
to
sir.
say, it is a temporary condition, and steroid
Yes,
has
sir.
been stopped already, and the patient
Yes,
will
sir.
improve. Your mother will improve gradually over the period of a few hours to few days time, and she will be
Yes, sir.
having the normal status, baseline status within few days time. Okay.
Yes, sir.
Another thing is mood doctor is already consulted, and he will see
Yes.
your mother. Okay.
What was it? I'm sorry,
Mood
sir.
doctor, mood doctor,
Yes.
the psychologist, the okay
Okay, sir. Mood doctor. Yes,
psychiatrist
sir.
or the mood doctor is already consulted, and he will see
Yes,
your
sir.
mother soon.
Yes,
Clear?
sir.
She
Yes,
may
sir.
ask, can you give me the exact timing? How many days she will be better? I'm sorry to tell you that exact timing is variable between patient to patient. Okay.
Yes, sir.
Uh, so you have to inform like this. Okay.
Yes, sir. Yes,
So
sir. So I can tell this line, sir. The exact timing is variable from patient to
yeah,
patient,
patient to
but it
patient.
is most
But
likely to.
usually within few
But
hours
yes, sir.
to few days time, patient will
Yes, sir.
will go back to the baseline status. Clear?
Yes, sir. Yes, sir. Yes, sir.
Okay. And then if you want to remember the percentage, how many percentage of the patient develop the steroid-induced psychosis, it is 5 to 18% patient can develop
Yes, sir.
steroid-induced psychosis. Okay.
Yes, sir.
And this steroid-induced psychosis usually occurs with high dose oral steroid.
Yes, sir.
Okay. She may ask you, or now you see there is no question and answer session between the candidate and the examiner, but the questions will be indirectly asked by the relative of the patient or the patient. What the
Yes, sir.
examiner used to ask before, now the patient will ask. Okay, like she
Yes,
said to you, is it a mistake, doctor? I want to launch a complaint. So it is not a mistake scenario. So So you have to
Yes, sir.
first, you have to, again, you have to reassure her, you have to give the background, you have to show the seriousness of the condition or the disease, then why we started, and then finally you have to say, no, it is not a mistake. It is not given by the mistake. Okay.
Yes, sir.
So like this. She may ask you what could be the other side effects of the steroid. So what you should say?
Sir, I can answer about. I can tell you, sir, now, sir.
Other side
Yeah,
effects of
patient.
steroid.
Yes, sir. The patient is more prone for bone fractures, and there may be a delay in healing of the wounds.
Mm-hmm.
And patient is also more prone to develop skin infections. Patient is
Mm-hmm.
also more prone to develop oral infections.
Mm-hmm.
These are
Okay.
some known. And patient is also more prone to develop weight gain, sir. More commonly around the chest and around the face and around the neck.
Okay. So again, your approach should be in these scenarios,
Yes,
our
sir.
approach should be very cautious, very cautious.
Yes, sir.
If you are
Yes, sir.
starting from the bone fracture, she will flare up again. She will fight with you. Okay.
Yes, sir. Yes, sir.
So you have to inform the more common side effect first, like it can cause heartburn. Okay.
Yes, sir.
But we are giving stomach protection medicine. Okay.
Yes.
It can cause like mood changes as your mother had. So
Yes,
sometimes
sir.
the patient have low mood, sometimes patient can have disturbance in the sleep. So we are giving the
Yes,
medicine in the morning time. Usually steroid is given in the morning time. So the sleep is not disturbed.
yes, sir.
Okay. Then you have to inform about it. It may cause increase in the blood pressure. It may cause worsening of the diabetes if the patient is having diabetes. Then the other side effects.
Yes, sir.
So what you have to do, you have to make the things simple, and you have to make the things like sugar coated, not to make her, because
Yes,
she is already angry, and your approach, if making more angriness, so you have to be very
yes, sir.
cautious about dealing in such situation.
Yes, yes, sir. So
Is
I
it?
should not explain about all the complications, sir. I will explain only these things, only
Yes,
common
yes,
things.
yes, because you have limited time, so you have
Yes, sir.
to focus mainly on those things which are more common, like heartburn, burning of the
Yes, sir.
burning sensation in the tummy area, upper tummy area. So we are already giving
Yes, sir.
PPI. Okay, so
Yes, sir.
on the long term, it can cause like bone thinning. It can cause bone weakness. So we
Yes,
will give bone supplement. Okay.
yes, sir.
In the long term, she will have the weight gain. So what we
Yes,
will
sir.
advise, we will advise the balanced diet. We will advise to have
Yes,
good activities, daily
yes,
walk. So she may not develop this increased weight gain. Okay.
yes, sir.
Mood changes, yes, we have to follow and see the risk and benefit. If the mood changes are like in this case, we have to stop the medicine. We have to consult again with the consultant who advise the treatment. Increase
Yes, sir.
chances of infection, yes. So what we have to do, we have to be uh, keep the vaccination updated for the patient, and we have to inform the patient that she should not go in close contact with the ill
Yes,
persons or the infected persons. Clear?
yes, sir.
So for every
Yes,
side
sir.
effects, you have to give some good news also, some good effects
Yes, sir.
also. So what you are
Yes, sir.
doing actually. So for every
Yes, sir.
side effects, we are trying to avoid that. Clear?
Yes, sir. Yes, sir.
So like this, skin thinning, easy bruisability, yes, but don't say like it will delay the healing. So she does not have any ulceration right now. Okay, so no
Yes, sir.
need to no need to highlight like this. So you can say skin thinning and skin easy bruisability is common.
Yes,
It can occur.
yes, sir.
Okay, so
Yes, sir.
if she asks you, what about the side effects?
Yes, sir.
Will these side effects go away or no?
Yes, sir.
What do you say?
Uh, Sir, this patient developed psychosis, sir. So we thought it would go away, sir. It is a reversible condition.
Other side effects?
Other side effects, certain conditions are reversible, sir. So patient is developing hypertension solely due to steroid. It is reversible, sir.
Yes,
Similarly, if the patient is developing increased blood glucose, so we are
yes.
stopping a steroid on a very short period. There is a chance for recovery. If the steroid is used for a longer period, there is a chance for permanently raised blood glucose level.
Okay.
And
You should remember that
bone thinning can happen.
most of the side effects will go away once the
Yes, sir.
once the steroid is stopped. Generally, okay. Most of the side
Yes, sir.
effects related to the
Yes,
steroid
sir.
will go away once the treatment is stopped. Clear?
Yes, sir.
If the side
Yes, sir.
effects
So I have
are,
to answer this only, sir. Most of the
yeah, yeah.
uh,
If she is asking
I have to
something
answer the
specific, if she is asking something specific, you have to highlight that
yes, sir.
specific one. Okay, like you said, blood
Yes,
pressure. If it is
yes,
because
sir.
of
So if
steroid,
you ask
it will
specifically, I
go
have
away.
to. Yes, sir. Yes, sir.
Okay.
If
If
she
it is
addresses
because of steroid, it will go
specific
away.
complaint,
If it is because of
yes, sir.
steroid, it will go away. If it is not because of
Yes,
steroid, but steroid is increasing, so it will be easy to
yes,
manage it, to
yes, sir.
control the blood pressure. And similar for the
Yes,
diabetes also.
yes, sir.
Okay. In that condition, if the patient is on long-term steroid, we have to give a steroid treatment card also to the patient. And you have to inform the patient that whenever you are going to any doctor, you have to inform that you are taking steroid daily basis.
Yes, sir.
Clear?
I'm clear, sir.
Thank you.
Yeah, thank you very much, sir. Thank you very much, sir. Yeah.
Okay, audience, do you have any question about this case?
Do the steroid, whatever we are giving to the patient, and steroid-induced psychosis patient is having, do
Mhm.
it completely reverse in most of the cases,
Yes.
or 100%
You
reversal is
can,
there, or it do sometimes doesn't reverse back also?
okay, it should be like you cannot say anything 100%. In most of the cases, it is reversible. Okay.
Okay. Okay.
Any other question from the audience? Okay, now we will, if there is no question, we will go to the next case, and the next case is by yes.